All right, let's jump right in. Welcome to this explainer, where we're going to explore a true unsung hero of the human body, your liver. Every single day, it fights behind the scenes to keep you healthy, balanced, and energized. But what happens when this absolute workhorse comes under attack? Today, we're demystifying hepatitis. We're unpacking the science, the symptoms, and the solutions, and we're using the clinical evidence to do it.
Here's our game plan for today. We'll meet your marvelous liver, define what hepatitis actually is, decode the viral alphabet, explore the symptoms and complications, look at diagnosis and treatments, and finally wrap up with prevention and living well.
Section 1. Meet your marvelous liver.
Before we talk about things going wrong, we've got to understand the baseline, right? Think of your liver as this relentless, massive chemical processing plant. It performs hundreds of tasks every single day just to keep us alive. It's pumping out bile for digesting fats, and it's a heavy-duty filter for metabolizing toxins and drugs. It's basically your body's battery pack, storing glycogen and regulating your blood sugar. Plus, it's churning out essential cholesterol, synthesizing proteins like albumin, creating the clotting factors so we don't bleed out, and it even has your back with vital immune functions. It is an absolute powerhouse.
Section 2. What exactly is hepatitis? So let's shift gears from our healthy hero to the main villain of today's story. At its core, hepatitis literally just means inflammation of the liver. Now, while viruses are one of the leading culprits globally, they aren't the only ones. This inflammation can absolutely be triggered by alcohol misuse, fatty liver disease, autoimmune responses where your body actually attacks itself, or even exposure to certain medications and toxins. Basically, it's a state of severe distress that totally hijacks all those amazing functions we just talked about. Clinically speaking, we break this distress down into two categories. You've got acute hepatitis, which is a short-term battle lasting less than 6 months, and then there's chronic hepatitis. That's the long-term war, where the inflammation drags on for over 6 months, causing some serious ongoing damage to the organ. Let's zoom in a bit and look at how that damage actually goes down on a microscopic level. It's a chain reaction. Step 1. An infection or injury damages your hepatocytes. Those are your liver cells. Step 2. Your own immune system spots the problem and goes on the offensive, attacking those infected cells. Step 3. This cellular battlefield leads to inflammation, and the liver physically swells up. Step 4. Because it's swollen and damaged, its vital functions start to tank. And finally, Step 5. If this turns chronic, that nonstop inflammation leads to fibrosis, which is essentially scarring, and eventually cirrhosis, or even liver cancer.
Section 3. Decoding the viral alphabet.
As we mentioned, viruses are massive drivers of this disease, so let's group the biggest invaders by their letters to keep them straight. These 5 distinct viruses actually operate pretty differently. Hepatitis A and E, they typically spread through contaminated food and water. They usually cause acute infections that clear up on their own, and hey, we have a highly effective vaccine for A. Then you've got the blood-borne heavy hitters, B, C, and D. Hepatitis B spreads via blood, sexual contact, or from mother to child at birth, but luckily, we've got a vaccine for it. Hepatitis C is primarily spread through blood exposure, like sharing needles. It often goes chronic and doesn't have a vaccine yet, but here's the good news, it's highly curable today. And finally, hepatitis D, that one's a hitchhiker. It only shows up if you already have hepatitis B, so keep that mental map handy.
But we really can't forget that viruses aren't the only threat out there. Non-viral causes are huge too. We're talking alcoholic hepatitis from heavy drinking, non-alcoholic steatohepatitis, often called NASH, which is linked to fatty liver. There's also autoimmune hepatitis, toxic hepatitis from intense medications or industrial chemicals, and even certain metabolic disorders. Your liver is literally taking hits from all angles.
Section 4. Symptoms and severe complications. So when your liver is losing the fight, how does your body sound the alarm? Honestly, ask yourself, how would you actually know if your liver is inflamed? It's tucked away deep inside your abdomen, so it's not like you can just look at a cut on your arm, right?
Well, here's what to watch out for. You might get hit with profound fatigue and a fever. You might feel a dull pain in your right upper abdomen, which is exactly where the liver sits. A super classic sign is jaundice. That's a yellowing of the skin and eyes, dark urine, and pale stool. That happens because the damaged liver can't do its job of breaking down a yellow pigment called bilirubin. You might also lose your appetite, feel nauseous, get joint pain, or even experience some really severe itching. But I really need to underscore the absolute urgency of these specific emergency warning signs. If you or someone you know experiences severe jaundice, sudden confusion, which happens when toxins the liver usually filters out make it all the way to the brain, vomiting blood, black stools, or severe abdominal swelling, Those are massive red flags. They point straight to acute liver failure, and immediate medical care is literally non-negotiable.
To put what's at stake into perspective, hepatitis is the initial inflammation. Catch it early, and it can often be reversed. But if left untreated, it progresses to cirrhosis. And cirrhosis is advanced disease. We're talking severe, permanent scarring, portal hypertension, and an incredibly high risk of liver failure and liver cancer. The whole goal is to stop this right at the inflammation stage.
Section 5. Diagnosis and medical treatments.
All right, time for the rescue mission. Let's look at how modern medicine steps in. The clinical pathway usually follows this exact sequence. First up, a detailed medical history and physical exam. Then, blood tests. Doctors are looking at liver function tests for specific enzymes like ALT and AST and checking for those viral markers we decoded earlier. Step 3 is imaging. They'll use an ultrasound or a specialized tool called a FibroScan that literally measures the stiffness of your liver to check for scarring. Sometimes they might need a liver biopsy. And finally, step 5. Armed with all this data, the specialist builds a fully tailored treatment plan.
Honestly, the most empowering part of modern medicine is just how effective these treatments have become. It totally depends on the cause, though. For Hep A and E, it's mostly supportive care while your body fights it off completely. For Hep B, we have specific antivirals like tenofovir for folks who need them. For Hepatitis C, medical science has actually delivered an absolute game changer: direct-acting antivirals, or DAAs, which are highly successful at curing the disease. Autoimmune hepatitis is typically managed with corticosteroids, and for end-stage liver disease, liver transplantation is a massive, life-saving surgical option.
Section 6. Prevention and living well.
Let's focus on building up our defenses, how we proactively protect and rehabilitate this vital organ. Rehab actually plays a massive role for folks dealing with liver disease. Chronic liver issues cause just profound exhaustion and muscle wasting. So targeted physiotherapy uses aerobic exercise and resistance training to boost physical function, help patients conserve energy to fight off that fatigue, stop muscle loss in its tracks, and just massively enhance their overall quality of life.
And then you've got your daily armor. These are the straightforward, actionable choices that serve as your ultimate defense. We're talking eating a balanced diet with plenty of protein, staying hydrated, and keeping a healthy weight to fend off fatty liver. Stepping back from alcohol and avoiding medications that put unnecessary stress on your system. Getting those vaccines for hepatitis A and B. And of course, practicing safe sex and avoiding needle sharing to block those bloodborne viruses.
I want to share this incredibly powerful, optimistic takeaway directly from the clinical guidelines. It says, early diagnosis, vaccination where available, appropriate medical treatment, healthy nutrition can prevent serious complications such as cirrhosis, liver failure, and liver cancer. I mean, we literally have the tools. We have the science right here.
Which brings us to one final thought. Your liver is in there fighting for you, filtering, producing, and storing every single day without you even asking. So what daily choice are you going to make today to protect your unsung hero? Thanks so much for joining me on this explainer. Keep learning, stay healthy, and please take care of your liver.